Hello everyone, so in this video we are going to talk about some basics of the chest trauma, starting with some basic points. Chest trauma or the thoracic injury constitute around 25% of all the injuries, and in another 25% it is contributed to other injuries. The most common cause of death in the case of chest trauma is hemorrhage, and in a blunt trauma it is tracheobronchial injury. We will start by understanding some basic anatomy forming a thoracic cavity and the thoracic inlet. So here we have ribs, sternum, the vertebra behind. The upper 7 ribs are the true ribs connected directly to the sternum via the cartilage. The below ribs from the 8 to 12 are what are known as false rib. The number 8 to 10 are attached to the cartilage, and 11th and 12th rib are the floating ribs. Interesting part to note here is that the first rib, second rib, and the last two floating ribs are least prone to injury. So, this is an important anatomy diagram. From inside out, we can observe the lung. Outside the lung, we have the pleura and the pleural cavity. Outside the pleural cavity, we have the ribs, and between the ribs we have three muscles: the innermost, that is innermost intercostal, then we have the internal intercostalis, and then we have the external intercostalis. Also to the ribs is attached the serratus anterior. Outside it we have the superficial fascia and then our skin. This is another diagram which tells us some important point. Here we note there is a upper rib and lower rib and three inner to the outer muscles as we discussed in the earlier diagram. What we need to understand is that there is a groove below the ribs that contains the intercostal vein, artery and nerve. So whenever we are going to insert something, that is for thoracocentesis, a needle or catheter being inserted, or for an intercostal nerve block, we are going to insert the needle or the catheter from the upper border of the lower rib. Okay, we will never insert a needle from the lower border, because in the lower border groove runs the intercostal nerve, artery and vessels. Starting with some basics, understanding what are the causes of chest trauma. So there can be a blunt trauma where a blunt force hits on the chest and causes the thoracic trauma. We can have a penetrating trauma where a projectile that enters the chest causes a small or a large hole. We can have a compressive injury where the thoracic cavity is being compressed between the two objects. Okay. Talking about the deadly dozen, the 12 condition which one should never forget. 6 of them are immediately life threatening and need immediate measures. 2 of them are pneumothorax, that is tension pneumothorax and open pneumothorax. We can have a massive hemothorax causing an immediate life threatening condition, and airway obstruction which need immediate measures, pericardial tamponade, and flail chest. The potentially life-threatening condition can be managed after some time. The aortic injuries involving the aortic rupture, we have the tracheobronchial injuries, the rupture of diaphragm, esophageal injuries, and pulmonary convulsion. So, as in other traumas, emergency traumas, similarly in a case of thoracic trauma, we start the general management with the ATLS guideline, that is Advanced Trauma and Life Support Guideline. It suggests that we have to do an early assessment and a primary survey simultaneously with an aggressive resuscitation. The secondary survey and full examination is to be done when the patient is stable, and then we transfer it to the definitive care. Following the ATLS guideline, looking for the airway, that is the first step to manage, we notice 3 points. The first one is airway patency and air exchange. We listen at nose and mouth for the breathing. We assess for intercostal and supraclavicular muscle retractions, and we assess oropharynx whether there is any foreign body that needs to be removed or not. In this image, we see that the patient's neck is being extended. By doing so, the airway comes in straight line and is prevented from collapsing and helps in maintaining the patency of the airway. That is the first step. So the second thing is breathing. So in breathing, we look for the abdominal movements or chest movements. We listen to the breathing sounds. and we feel the breathing. The shallow respiration is an early indicator of distress, and cyanosis is a late indicator of respiratory distress. So, in while maintaining the circulation, we look onto the skin for any changes in color, the temperature changes, capillary refill time, which do need not to be more than 3 seconds, and we look for cyanosis in the peripheries. We assess the pulse by measuring the distal pulses. We look its rate and regularity and the rhythm. We look the neck vein for distension or flat neck veins. Flat neck veins suggest dehydration and decreased fluid outflow from the heart. Okay, and a distended neck vein suggests some kind of compression causing the jugular venous pressure to rise. We also assess the BP while maintaining the circulation. So let's discuss the consequences of a blunt trauma to the chest. Okay, these will include the simple to the complex injuries. On the left side, we are seeing some simple injuries following the chest blunt trauma. So the first one is the costovertebral dislocation, that is dislocation of rib from its joint at the level of vertebra. Okay, the second one is the transverse rib fracture as shown in the image. The third is the oblique rib fracture. The fourth is overriding of the rib fracture between the ribs. So next we can have a chondral fracture, that is the cartilage itself getting fractured at some point, or we can have a costochondral separation, that is the attachment of the rib at the level of cartilage is getting separated. We can also have the disattachment of the cartilage directly from the sternum, that is the chondrosternal separation, or a very severe trauma can cause directly a sternum fracture, that is rare and seen in severe traumas. The complicated results of a blunt trauma, the first one is the traumatization of the pleura and the lung parenchyma. This occurs because of shaft pointed rib fragment that is formed, and the rupture of the pleura will result in pneumothorax, as well as there can be subcutaneous emphysema seen. There can be multiple rib fractures in a severe injury, as you are seeing in this image. As there are intercostal vessels running in the costal groove, an injury to the rib can result in rupture of these vessels, resulting in the hemothorax. Okay, there can be there can be injury to the heart or the great vessel seen, or a puncture wound can be formed as these rib segments are sharp and act as a missile.